I faked my demise. Extreme, I know. But suddenly we all are talking about cervical cancer, aren't we?
So what is cervical cancer? Who is at risk? And इससे बचना कैसे? Cervical cancer is the second most common cancer among women in India. As per a WHO report released on February 1st, new cases of cervical cancer among Indian women is 17.7%. Or according to GloboCan 2020, the International Agency for Research on Cancer estimated 1,23,907 new cervical cancer cases and 77,348 deaths in India. So, ये cervical cancer होता क्या है? It is a type of cancer that originates in the cervix, the lower part of the uterus that connects to the vagina. Cervical cancer is primarily caused by the human papilloma virus, yani HPV, a sexually transmitted infection. Although the virus is removed by the body's immune system, लेकिन अगर ये एक high risk वाला है like HPV 16 or HPV 18, the chances of it remaining stubborn and causing cancer jump are high. You know, there are 200 HPV viruses that sexually active people are infected with at some point in their lives. But इसका मतलब ये नहीं है कि सब कैंसर में डेवलप होंगे. The good news is vaccines are available. ये होता कैसे है? The primary cause of cervical cancer is persistent infection with high risk strains of HPV, particularly HPV type 16 and 18. ये HPV is transmitted through sexual contact and can lead to changes in the cells of the cervix, eventually progressing to cancer if it's left untreated. कुछ फैक्टर्स ऐसे हैं जिसकी वजह से you might be at a higher risk to get cervical cancer, जैसे if you're under 45 तो आपको काफी ध्यान देना चाहिए, especially women. Or you have multiple sexual partners, a weakened immune system like if you have HIV or AIDS, early sexual activity, or you have given birth to multiple children at an early age, or you have had a vaginal, vulval, kidney or bladder cancer in the past. या फिर your mother took hormonal medicine while pregnant with you. और इसके symptoms क्या हैं and what about diagnosis? See, early stages में इसके symptoms नहीं दिखेंगे, लेकिन जब दिखेंगे तो they could be vaginal bleeding, pelvic pain, pain during intercourse, and an unusual vaginal discharge या watery or foul smelling discharge. ऐसा कोई भी symptom लग रहा है आपको तो go through a combination of pelvic examination, pap smear, HPV testing, biopsy and imaging studies like ultrasound or MRI. तो ये pap test can detect cancer cells and should be taken by every girl who is entering adulthood along with screening intervals ranging from 3 to 5 years. इसकी कोई तो वैक्सीन होगी, इससे बचना कैसे है? देखो, पहले तो ये है कि रेगुलर टेस्ट करवाओ और आपकी बॉडी जो आपको हिंट्स दे रही है उसे सीरियसली लो एंड कंसल्ट अ डॉक्टर अकॉर्डिंगली. दूसरा, cervical cancer is preventable and curable if you get vaccinated against the HPV virus. अब India has its own HPV vaccine, Cervavac, which targets 4 types of HPV infections and should be taken by girls between the ages of 9 and 14 as per experts. Abhi, as per reports, it is commercially available for 2,000 rupees per dose. Also, you need to include a healthy, balanced diet and lead a good lifestyle and definitely quit smoking. And कई states ने proactive steps लिए हैं, जैसे Delhi initiated a program for girls aged 9 to 14 in 2016, जहां National Technical Advisory Group for Immunization recommended introduction of HPV vaccine in the Universal Immunization Program with a one-time catch-up for 9 to 14-year-old adolescent girls following with routine introduction at 9 years. Punjab, Sikkim, Karnataka, Tamil Nadu, Chhattisgarh and Maharashtra have announced free HPV vaccination for schoolgirls in specific districts as a part of pilot programs. Mizoram has included free HPV vaccination in its routine immunization program for girls aged 10 to 12 years, while Uttar Pradesh has also announced free HPV vaccination for schoolgirls in select districts as a part of pilot program. और अभी यूनियन फाइनेंस मिनिस्टर निर्मला सीतारमण ने February 1 को अनाउंस किया about the government's plan to focus on vaccination against cervical cancer for girls aged 9 to 14 as a part of her interim budget 2024. That's the gist. See you in the next one.